Thank you so much for staying with Daybreak. We're getting into the discussion in just a bit. The hashtag is Daybreak. You can call in 0719 777. You can tweet at Trevor Mbija, at ZinziK. And by the way, we're not asking you any question. We just want to hear your views on the health insurance debate. It's one issue that has been going on online for a while now. Many people wondering what pre-existing condition is, why health insurance doesn't pay their claims when they want it, and why it's not being done on time.
Should I even be on health insurance in the first place?
Exactly.
Why is it important?
And how does NHIF come in? Should we even have just NHIF on its own? Does it work? Is the system properly constituted as it is? Most of the complaints are the things we want to hear from you this morning. And also we'll be looking at the newspapers. But before we get into that, let me introduce my panelists, beginning from my immediate left. Dr. Elizabeth Wala, Programs Director, Health System Strengthening at AMREF. Thank you so much for making time. We also have Dr. Alex Muturi, Kenya Medical Practitioners and Dentists Union Trustee. We also have Honorable James Nyikal, MP Semen, Member of Health Committee in the National Assembly. Thanks for making time. And Michael Njau, NHIF Manager, Thika Branch. Thanks for coming in this morning. We'll take a look at the newspaper's front page first, and we'll start with, which one do you want to start with? Daily Nation?
Daily Nation looks interesting.
All right, okay. Brilliant. Illegal pay shock for civil servants. That's the front page. And of course, one of the stories, and the teacher was here as well, promotion for Tabichi. Teacher Service Commission says it will reward a hero teacher who won Global Award last weekend and who traveled back home to a hero's welcome yesterday. He was here and he said that he will use his prize money to strengthen the people around him and also share with the students and the teaching fraternity as well.
Very selfless.
There is 100 million shillings. Uhuru Ruto meetings come storm within Jubilee. That's also on the front page of the Daily Nation, and the story continues on page 6. And Migingo SGR top Museveni visit agenda. That's on the front page of the Daily Nation. Let's take a look at the Standard. Mystery of County millionaire. Court freezes ex-Nyandarua County Finance Officer's account with 115 million and assets worth 181 million as EACC probe continues. That's according to a source of his wealth is now under scrutiny.
And of course, there on page 4, you can see more questions as the kickback probe ends. This is in terms of the dam scandal that we've been seeing. The detectives who flew to Mombasa to question Devolution CS Eugene Wamalo and managers at a construction site linked to a prominent Jubilee politician. Of course, the Standard newspaper has also highlighted President Museveni's visit in Mombasa. It comes at a very important time when we've been seeing border road between Rwanda and that of Uganda. Not so long ago, about 2 weeks ago, President Uhuru himself was also in Uganda. Then, of course, the biggest story right there, 140, that's the allowance for civil servants to go in terms of tightening belts. The Salaries and Commission hastens process for slashing plum side payments state employees. This is coming even in the backdrop as the MPs are requesting for a luxurious gym, a 5-star food hotel, or rather catering, and much more.
Yeah. And we should start with Honorable on that. Is this the right, Honorable Nyikal, is this the right way to say? First of all, where do you stand in the whole push by MPs to have better packs?
Basically, what was this was a report of a team that visited New Zealand, and what they were really saying was how things are out there. So when people visit, the committee goes out, they give a report to Parliament. So basically, what they were saying is, what is it that goes out there? I wasn't in the house on that day, but what I know is it was a report of that. I don't think at this time we are pushing for this 5-star food, this gym. It's not a big thing in the house.
But you would admit that if MPs go to New Zealand and that's the only thing they come back with, there's a problem right there, right? No,
it's not the only thing they come back with. The Parliament works in committees, and each committee has a specific thing they do. If say the health committee goes, they go on health matters, and so what they report is health matters. But so this particular committee, that is really looking at services in Parliament, so that's what it does.
Isn't it as good as it comes as we stand? Services in Parliament, are you satisfied? You're amongst the highest paid legislators in the world.
Myself, I'm satisfied with what we have. In fact, not only us, but a lot of middle-income Kenyans who are in positions where they can get food in the environment. I think it's a big health risk to them. Because in my mind, availability of food, if the quality of food is not looked at, constant and easy availability of food is a huge health risk. Okay. So to me, it's not a big issue. Okay. It's not something I would raise a fist on and fight for.
Hold that thought in just a bit. We'll come back and get your views on this. But let's go to Muturi. Muturi, what do you think? Is this the right way of handling it? Slashing some civil servants' allowances?
Yes, as a civil servant and a representative of civil servants in the health sector, we've always had problems with the mandate of SRC. Because when you look at the Constitution, it's very clear who they are supposed to guide. It is the state officers. But they found that very difficult because of the friction between themselves and the state officers. So they landed on the easier target, who are the civil servants. And they found themselves having increasingly more say about what they should earn. SRC has never come up with a proposal on how to improve anything in the civil servants in terms of their take-home. It's always about what to reduce, what to take away, and what to alter. As a union, as KMPDU, we are 100% opposed to this, or any suggestion of slashing the existing allowances, because when you look at the spirit in which they were negotiated, it was to improve the take-home. I'm not obsessed with what those allowances are called. I'm more interested with the bottom line, what the worker takes home, to be able to have some semblance of a decent living. Because when you look at the environment in which they work, they deny themselves of a lot of their own personal comforts. And I think it's important that someone recognizes that in view of what it is that they're supposed to do. So when someone comes up with a list of allowances, which casually looking at them, you see they are actually targeted at the healthcare workers. I'll just quickly run through what I picked in a minute. You look at the non-practicing allowance, the risk allowance, the house allowance, the healthcare workers extraneous allowance, the commuter allowance, and the annual leave allowance. These are allowances that were negotiated by the various healthcare workers unions to, at the end of the day, improve the take-home. So we can call them just one word allowance. It doesn't really bother us as long as the take-home remains. Any threat at reducing the existing take-home of the various healthcare workers, whether they are doctors or nurses or the other cadres, of course we will be met with resistance. Of course it will be met with a threat to withdraw services. And I don't think this is the direction the country wants to take now.
So at this point, is that a threat?
I wouldn't call it a threat, but it's more of a promise that you alter the existing take-home of the healthcare workers, and you are inviting chaos in that sector.
Okay.
All right, Dr. Elizabeth, just as a taxpayer, when you see this conversation about allowance and the increase, or on one side slashing allowances for civil servants, and on the other side our MPs asking for better quote-unquote services, as a taxpayer, what comes to your mind?
As a taxpayer, I actually feel I'm irritated because I think we have our priorities upside down as a country. We do not allocate our resources efficiently. In this case, we have our pyramid of income earners is that we have a very small pool of people who take home ridiculous amounts of money. And then we have the bottom area who are the people who are actually implementing or on the ground, who are scrambling for the little resources that are there, and we are further repressing them. So being in a tax bracket that's one of the highest means that I, as a taxpayer, would want to ensure that my taxes go to service delivery.
Right.
I live in an estate where right now I'm struggling to get water in the house. We are struggling to get proper roads. We are struggling to get security. We are struggling to get services in our public facilities. So it is very painful that you pay taxes, but the taxes are being directed to the wrong areas.
Right. I mean, Honorable Nyekal, you talk about New Zealand, but Kenya doesn't have New Zealand's healthcare, education system, transport system. So by the time I'm sure New Zealand is giving a very good pay for their politicians, the politicians have delivered on this end.
Let me, don't corner me into this, because I don't believe in it, and I don't think it was a big debate in the House. This is not going to take even 1% of our time. Nobody is asking for these things. But let's talk about the wage bill.
Yeah.
And I want to talk about it in 3 ways. One, as a country, we went wrong at the time of devolution. And what we're dealing with is numbers other than pay. I can tell you, even if you go to the very high level of civil servants, they earn less than the 2 of you there. That is for sure. Now, the history of this tax bill with devolution goes like this. Before we devolved, we had a fully fledged civil service that stretched from the national to the ground, to the lowest level. Everybody was there. On top of that, the local authorities had people who were fully employed. Now, when devolution came, there's something that didn't happen. The Transition to Devolved Government Act arising from Schedule 6 was not implemented to date. And what took over from it, the Intergovernmental Relations Technical Committee, has also not worked. So what happened? We should have just truncated the civil service so that people at a certain level would then report to the governor. The governors would probably like to replace them on their will, depending on their performance. But what we did, we retained the whole lot that was there for the civil service. We retained the whole lot that was there for the local authorities. And then the governors employed their own people. We have 3 tiers of people in the public service. Who are some of them doing? If you go down to the counties, a lot of duplication. You'll find 3 offices that do the same thing. One from the old local authority, one from the national government, one with the new county government. And that has not been harmonized. To date, nobody has gone and said, how many workers do you need for the health sector in this county, for the agriculture sector in this county? We took what was there, plus local authorities, and added more. So that is the basic thing we should look at. What is the origin of the allowances? And I can talk about this because there are some of them I took part in, and my colleagues here will, in the health sector. The issue with the health sector is that they actually work longer hours than most people. You can talk about their commitment and so on, but they still work longer hours. And around 2003, the health workers actually, they have gone on many strikes. And when it was actually assessed, it was found by the public service that hour for hour, they were paid very poorly. And therefore, now there was need to increase their take home. But then the public service said, we cannot take one lot of people and lift them high above the others. It will distort the system. So what was agreed for these people, we will put some allowances, like extraneous allowance. Extraneous was because you find a doctor who is on duty from Friday to Sunday. I've done that in my younger days. Friday to Sunday all through. A nurse who is working, if the time to go has come, the theater, they'll still continue working. And so he said, okay, let's compensate those. So they brought extraneous allowances, non-practice allowances, because their colleagues, if you take doctors who in private practice, were earning a lot more. And so those kind of allowances were put up. The basic reason was to be able to give them better take home while within the same structure in the civil service. So actually I've always argued that this is actually bad for the civil servants, because when they are going to calculate their terminal benefits, they go for the basic pay. The allowances do not. So again, as a country, instead of going for the details of an issue and look at where the problem, we take the easy way out. We sit and say, if you remove this, they are doing simple arithmetic. It's not even maths. If we take out these allowances and we remain with the basics, we'll solve the problem. You must ask, what brought the allowances? Now, what then happened after the doctor's strike and these allowances were to just help them? Was then other cadres started to emulate, we also want extraneous allowance, we also want... The allowances grew without the basic reason for them.
Yeah.
So what we should look back, in my view, if you ask me, I would go down, despite the issue of unemployment, I would actually work on how we reduce the number of people, the number of employees. And if you ask me, even in Parliament, I would say yes. So reduce
Is that a better
number.
approach from slashing allowances and having more people?
Yeah, I think you would
because
have...
then many people will lose jobs if that happens.
That is true.
Yeah.
But you see, when you give people, you keep people in employment because you are afraid of unemployment, then you are giving unemployment benefits through a back door. Okay, if you just want them to get some pay, then say, okay, we are going to create unemployment benefit. Yeah. This is something, a social protection. I actually had been involved in the old people's cash transfer, people with disability cash transfer. Yeah. So don't use the salary or the employment in the public service as a solution to unemployment. People should be employed to work and produce. People should not be employed so that they have an income. There's another problem with employing people because they need an income. Yeah. If you say, like we always say, you know, when we use nepotism, can you employ this cousin of mine so that he can get some means of livelihood? Look at your objective. The objective is not to get work done, but to get this man to get a livelihood. Yeah. Are you therefore expected to get some results from them? So the objective has been met.
The solution you're offering is, instead of slashing salaries, reduce the numbers.
Yes.
Okay.
You agree with that?
Justify. I think instead of using the word reduce, justify.
Justify.
I'm in agreement with Dr. Nyikal, especially about the counties.
Yeah.
I work in a county facility, and sometimes you get disturbed by the support staff that who are sent to work for you, and you're just trying to reason how they ended up being sent, because when you look at their qualifications, they're completely not suited for the position they find themselves in. And like Dr. Nyikal has alluded, there is a lot of hiring either to fulfill a political promise or to honor a social requirement. And I think that's where much of this extra money is going to. Personally, I don't believe we have a wage bill crisis in this country. I think it's a word that's thrown around to sort of contain workers whenever they want to agitate for better pay. It's a word that is conveniently brought from the closet to contain them. You know, when you threaten them with freezing of their employment or reducing the benefits, they are likely to take a step back when they want to agitate for better pay. So it's a mode of mind control, in my opinion. Now, the SRC, as is currently constituted, I think does more harm to productivity in this country than good. Because if you look at their deliberate shifting away from regulating the state officers to every day someone wakes up with a new method of how to squeeze the civil servants even more. What are you doing to their productivity, honestly? Because if you listen to the SRC chairperson right now, she'll tell you she's spending countless hours trying to harmonize the wage bill. But when you ask her how this harmonization in her mind is happening, she's not looking at what Dr. Nyikal is talking about. She's not looking at redundancy. She's not looking at people who are occupying positions that are actually not delivering. She's looking at the existing people, some of which are working extremely hard, and seeing how do we make them earn less. And I don't think it's good for motivating a workforce that's already facing very tough economic times. Because when you remove this 140 allowances, I think in some quarters she is going to be scored very highly because she has managed to bring down the expenditure. But when you look at what she has done in terms of the output of these affected workers, it's going to be reflected in terms of how the economy does, in terms of how the health of the people will perform. So I think SRC needs to rethink their strategy as far as containing this pay rise issue is concerned. I don't think there is any ballooning of the wage bill.
All right. Okay.
I honestly believe the only thing that is ballooning and the only thing that needs to be contained is SRC tendency to overstep their mandate. Okay.